right, the next instructional video we're going to do for you is for the thoracic vertebra. We're going to be doing AP, lateral, and the swimmer's view. So we're going to start with the AP view. So we're going to be doing all these standing at the wall bucky. The first two we'll be using a 14x17 cassette, and then for the swimmers we will just be using a 10x12. So I'll start with the AP. Grab my cassette here with the orange sticker down. That's my bucky. And Mrs. Skaggs is going to be my patient. I'm going to lower this down behind her because I know her thoracic isn't above her head. And we'll be doing 40 inches SID for this one, so I'm going to sneak in a bunch closer. And of course, we'll be shielding our patient, always. So I'm going to have her just put her back up against this board. And for the AP, I'm going to get her right down the middle from side to side. And then we are going to put our IR 1.5 to 2 inches above her jugular notch here. You can do that by looking at your light, since your tube automatically collimates to your cassette, or you can do this by pulling out your bucky tray and looking to see if you're there. We are there right now, and I'm already lined up almost with my bucky. I'm going to make sure she's not got any hooks in her bra that will be right in the middle of her back, or under wire, or a necklace, or anything that's going to be in this picture. And I am going to collimate in side to side quite a bit here, because all we're looking at is just the spine. Grab my marker here. You can mark the right side or the left side, doesn't make a difference. I just happen to have my left marker, so I'm going to mark over here. I'm going to mark up high because I know I'm in the light here and I can make sure I'm not going to be in the anatomy. For some reason this just looks like it's a lot. Erase this up there. Alright, so making sure she's standing up nice and tall, flat against that IR, and I'm going to have her take in a deep breath for me and hold her breath, and I'm going to expose at 90 kVp. I'm having her hold her breath in nice and deep so that way it's consistent all the way down her T-spine. Then we're going to get a lateral view, so it's going to be a left lateral. I'm going to have her turn to her left. Yep, we're going to spin that shield, which she did for herself. Sorry. It's okay. Then I'm going to have her bring her arms out in front of her so that they are not hanging in the back of her spine. If they were down, they would be right where we're looking. So we want to make sure they're out of the way. However you want to do that for your patient, that's fine. If they can hold their arms up here easier, that's fine. Doesn't make a difference so long as they're out in front and they're not in our way. I'm going to scoot her to her left so her left side is all the way up against here. And then I'm going to start looking to my centering. I'm going to make sure she's really, really lateral, because it's very important for this one that the vertebra be nice and lateral. And I'm going to be centering between the midline of her body and the back of her here. So I want to make sure that I'm not centering straight down the middle of her. I might clip the back of her spine. And I don't want to be centering back too far, because then I might clip the front of it. The thoracic spine has a nice kyphotic curve to it, so we've got to make sure we get the entire thing. So I'm going to get her body nice and lateral. I'm going to center between her midline and the posterior portion of her. I'm actually going to open up side to side a little bit here so that I can really see. I only have just a sliver of light behind her here. I don't want all this dramatic light on your bucky like this and just leaving it open. That's way too much. We're just going to kind of bring it in real close to her. For this one, we could do suspend her breathing like we did before. I would probably do an inspiration, take a deep breath in, hold your breath. Or we could do a breathing technique. which we're not going to discuss in this practical, but it is a possibility for the lateral. But for this, we'll just have you do an inspiration, and we'll expose at 90 kVp. And the last one that we're going to be doing is the swimmer's view. And for the swimmer's view, we're going to be using a 10 by 12 cassette, so I'm going to swap out my cassettes here. I'm going to be putting this in lengthwise or portrait, with our orange sticker at the bottom. Now this view, we are trying to see something that we might not be able to see due to the shoulders on the lateral thoracic, and that is the space and the area between C7 and T1. C7 is where that little bone sticks out here really nice. So we're looking right here, which is exactly, if you can see right across, is where her shoulder is. So that's why we have trouble seeing it. So we do this extra view to see it. I'm going to put a 5-degree caudal angle on my tube, and then I'm going to raise up, and I'm going to raise up until I get to about where that space is that I'm looking, that C7T1. It's right about the top of the shoulder here, right around from the humeral head. It's just right there in that little, typically there's a divot there. So I'm going to lower down a little bit, and I'm going to line my bucky up. Doing all of this before I position my patient, because the position I'm going to put her in, it can be a little uncomfortable. I'm going to take my marker, and I'm actually going to move it back here where I can see a little better, because she's in lateral, left lateral, so I'm using my left marker, but it doesn't matter if it's in front or back, so I'm going to put it back here where I can keep an eye on it. You can mark either way. I'm going to have her raise this left arm all the way up, and I'm going to have her drop this right arm all the way down. That's why we call it swimmers, because it's just like swimming. Just keep swimming. Then I'm going to collimate a little bit. I'm going to be right down the midline of her, right down her neck, right down her body. If they have a hard time lowering this shoulder, again, you can add the sandbag. We're not going to require that of you for this practical, but just for your personal knowledge. I'm lining her up very much centered, and I'm collimating down to this area, getting nice and close. This, since we are putting an angle on and we're going right through the shoulder area, we're going to crank our kVp up to 96, and then we are going to expose just like that. And that is your thoracic spine.